At Complete, we see loads of ankle and foot issues. In fact, they're very common indeed. And we see it in people that run, that are doing marathons, ultra marathons, but we also see it in people that just want to walk to the shop, but they're getting pain and finding it very limiting. As you can imagine, it's quite a complicated area, the ankle and the foot. There's lots of bones, lots of nerves, lots of tendons, muscles and ligaments, and they can all generate pain. Therefore, it's really, really important that before you embark on any sort of treatment, that we've got a really clear diagnosis. At Complete, we will carry out a very comprehensive assessment. We will assess all your muscles, your tendons, but we will also carry out a diagnostic ultrasound scan, and that will allow us to look underneath the skin. By adding the diagnostic ultrasound scan, that gives us the confidence that we know exactly what we're treating. From that, we will obviously be able to implement the best treatment program for you to get you back to your function as soon as possible. If you have had a confirmed diagnosis such as arthritis or tendinopathy and things aren't improving, or you have high levels of pain that is meaning that you can't even go for short walks, or you can't run, then it may be that an ultrasound guided injection is appropriate for you. We do lots of different types of injections. We inject into the joints, we inject around tendons, and also we do sometimes inject in and around the ligaments. Obviously, before we carry out any procedure, we will do a full clinical assessment and carry out an ultrasound scan to ensure that we're first of all targeting the right area, and also we're ensuring that it is the most appropriate thing for you at that time in your treatment phase. Following the injection, hopefully you get significant pain relief, and that can be followed up with a course of physiotherapy. At the back of the ankle, we do see lots of footballers and runners that get pain in here, which is a condition called posterior impingement. You can actually get something called anterior impingement or footballer's ankle. We also see lots of people with calf problems and Achilles tendon problems. Sometimes those are also associated with something called a bursitis, which we also see quite a lot of, not just in runners, but in people that go for long walks and hiking. And the last condition we're going to talk about is plantar fasciitis. Now that's when you get pain in the heel. It's particularly worse in the morning and can be quite a difficult condition to get better. It always causes quite specific pain on the heel. We see lots of patients with pain at the front of the ankle, which could be the joint, such as osteoarthritis, or it could be the tendons. But we also see people that have got ligament sprains. For example, they've sprained the ligaments on the inside, which is the deltoid, or more commonly, you've turned your ankle in and you've still got pain on the outside of the ankle. And it's not uncommon after an ankle sprain to still get some discomfort in this region, even after 2 to 3 months. We also see patients, in fact quite a lot of patients, with big toe pain. So they get pain in this joint, and that can respond quite nicely to a few different types of treatment interventions. We also see a lot of runners with forefoot pain. So that's pain underneath the foot, particularly in the ball of the foot. And that can be a condition such as capsulitis of the toe, or most commonly a Morton's neuroma or intermetatarsal bursitis. Well, we do hope you enjoyed the video, and if you have found it useful, then please do subscribe to the Complete Physio channel and like it, and even make a comment.